The needle can be inserted either parallel or perpendicular to the transducer. The safest and easiest way to do FNA is to insert the needle right next to the probe, parallel to the transducer. Be careful not to poke the sterilized cover sheet. After inserting the needle, you should watch the entire length of the needle on ultrasound. On the other hand, when the needle is inserted perpendicular to the transducer, the US image shows only the needle tip as a bright echogenic spot. Personally, I prefer this approach because this has a shorter path than parallel insertion. Before needle insertion, the performer should decide on the entry site. To avoid direct puncture of vessels, color Doppler should be activated. After that, we can easily find a safe entry site. Next, I will show you a video on deciding on an entry site. When the needle is inserted into the nodule, needle movement is continuously visualized in real time on the monitor. Within a few seconds, thyroid aspirate appears in the needle hub. At that point, the needle is withdrawn. After biopsy has been completed, a sterilized gauze is applied at the needle insertion site. And the patient should be taught to compress the biopsy site for at least 30 minutes. To get good FNA results, the needle position should be changed during to and fro motion. We do not know whether we have targeted at the exact cancer foci with only US images. In this case, the center of mass was cancer, and the periphery was mostly fibrosis. If the needle had passed through the peripheral portion only, we may have not reached the exact diagnosis of malignancy. This lesion was proven as papillary carcinoma. I will show you the video on different positioning of the needle during to and fro motion. This next case shows a calcified nodule in the right thyroid. US-guided FNA was done, targeting at the solid portion, not calcification, and the result was papillary carcinoma. After withdrawing the needle should be disconnected from the syringe. Then, fix the needle tip onto the slide, and flick the needle hub onto the slide. This helps in obtaining more cellularity. One important point you should keep in mind is that the slides should be fixed immediately in alcohol after smearing the specimen. If not, dry artifact may develop which interferes with cytologic interpretation. The remaining sample in the needle hub is directly immersed in saline solution for cell block. Thank you.